Hello, my name is Helen Park, and I'm here to present the feasibility study on RxCentral, a national database warehouse created to store prescription information across all healthcare systems. The number of prescriptions filled in the United States increases every year. Currently, over 4 billion prescriptions are filled by retail pharmacies alone. This does not include those filled by hospitals or by mail-order pharmacies. The rate of growth is impacted by three factors over the next decade: the aging population, the growing number of generic medications available to market, and healthcare reform. Currently, the average number of medications per person in the United States is 12. If you look at the patients who are age 65 and older, this number increases to 28. The potential of drug-drug interactions grows exponentially as the number of medications increase. And with so many medications, it quickly becomes overwhelming and confusing for most patients. Adding to this confusion is the fact that most Americans utilize more than one pharmacy and have more than one provider, who often do not know what the other one is prescribing. What is amazing is that no system currently exists to keep track of all this information, and that is not surprising considering the vast amounts of information traveling across multiple systems. A study conducted by Budnitz et al. Documented that nearly 50,000 hospitalizations occur annually due to preventable adverse drug events. The Department of Health and Human Services recently documented that each Medicaid recipient has an average of $1,000 worth of medications that are not needed prescribed for them every year. These figures represent an enormous amount of waste within the healthcare system and an increased risk for misadventures for patients. Medication reconciliation is the process by which lists of medications from various sources are compared to create an up-to-date and comprehensive medication list. The process is vital to patient care in assuring that drug interactions are minimized and duplications are not created. Despite the use of electronic medical records, our healthcare system has not been able to standardize the medication reconciliation process across these systems. RxCentral's goal is to develop a database that will connect these channels of information to create a single repository, finally enabling providers and pharmacists to perform medication reconciliation in an efficient and easy manner. Ultimately, RxCentral will prevent drug interactions, reduce healthcare costs, and save lives. As a database warehouse, RxCentral is part of the data processing and hosting industry, which has an $81.3 billion market and consists of over 47,000 businesses. The average profitability for this industry is 12%. Market segmentation is diverse, with the largest segment represented by business process management and data processing. The two largest players are Hewlett-Packard and International Business Machines Corporation. Together, they comprise about 30% of market share. The market has low concentration and there is no major player focused on addressing the needs of the healthcare businesses. The industry profitability is projected at 5.9% for 2012, with an average of 3.1% between 2012 and 2017. Key success factors for this industry include effective quality control, cost-effective distribution system, ability to quickly adopt new technology, ability to manage external contracts for outsourcing, access to a multi-skilled and flexible workforce, and ensuring appropriate pricing policy. In looking at the forces of competition, there are only two significant sources at play. There is minimal internal competition as no direct competitor exists in the marketplace. The threat of new entrants is also minimal due to the high capital investment needed. And as a first mover, RxCentral has a tremendous advantage, as new entrants will need to lure contracts away at a significant decrease to revenues to be competitive. Threat of substitute products is also minimal, as currently medication reconciliation is done manually, requiring significant investments in time and manpower. Buyers have a high switching cost due to the current practice of performing medication reconciliation. However, if pricing sensitivities exist, they may be disinclined to purchase access to the database. This will largely depend on their estimation of the value proposition. Suppliers, on the other hand, hold moderate influence since their cooperation is needed to access the data. The healthcare environment must also be considered as the backdrop to all this. Three significant factors will further impact the demand for RxCentral in the future: The geriatric population utilizes the most prescriptions and is the fastest growing demographic in the United States. Individuals unable to access health care will be granted access by healthcare reform, resulting in overburdening of the healthcare system and increasing the number of prescriptions dispensed annually. And finally, the diminishing number of general practitioners and the increase in patients will create a significant gap in primary care providers, and tools such as RxCentral need to become part of the infrastructure to assist providers and pharmacists. Market research was conducted using surveys and in-person interviews with a group of pharmacy gurus selected for their expertise, as well as target customers representing various facets of pharmacy practice. Hypotheses based on the 9 building blocks were tested as follows. The value proposition was strongly supported by all, and the 3 primary benefits were substantiated. Identifying the primary customer base proved to be a more difficult task. The original hypothesis was that the insurance companies would become the primary customer. Although the initial feedback supported this hypothesis, further investigation and research led to proving that pharmacies were the true customers. The customer base then will include both community-based and hospital-based pharmacies. These 2 entities are connected indirectly through a series of information processing channels, but remain separate. RxCentral provides the connection between pharmacies so that patient information can be shared. In essence, RxCentral becomes a central hub for pharmacies, pharmacy benefit managers, and insurance companies. The primary channel of distribution is internet-based via a secured website. Elements that are required include secured access and data transfer that includes ability to upload over-the-counter medication information, unique identifiers for logon, 24/7 accessibility and technical support, real-time data upload, automated and user-friendly format, and multi-interface capability. Key resources include pharmacies and PBMs who supply the data on prescriptions and OTC information, and key activities include medication reconciliation, prevention of drug-drug interactions, and prevention of duplicate therapies. Key partnerships include all stakeholders, including health insurance companies, regulatory agencies, professional organizations, consumer advocacy groups, and others. The primary revenue stream will be generated by charging a subscription fee for site licenses. The fee will be based on the total number of end users per site. The potential market, when considering the number of existing business entities in both retail and hospital pharmacies, exceeds over $500 million per year. The cost structure consists of an initial investment to develop the database. The majority of the expenses will be for salaries and wages, as the database requires individuals with very high technical expertise. Secondary expenses include maintenance of the equipment and advertisement. The net revenue at the end of year 1 is expected to be about $685,000. The break-even point is calculated to occur in month 5. However, considering the pre-operations investment of $350,000 to $400,000 that's needed, the actual break-even point will most likely occur in month 9. There are multiple funding sources available aside from the personal investment of $10,000. Numerous grants are currently available for healthcare reform projects, as well as for pharmacoeconomic research and development. RxCentral will qualify for both, as well as a number of other resources for grants. Any deficits not covered by grants will need to be met by venture capitalist investments and business loans. Despite the amount of investment needed, if the projections and sales are met, the investment will be repaid in full before the end of the first year, with a net profit between $100,000 and $200,000. RxCentral provides an effective tool to ensure patient safety and will prevent harmful drug interactions, reduce overall healthcare costs, and save lives. The market research provides evidence in accordance with requirements of the 9 blocks, and projected revenues and expenses demonstrate that RxCentral is a sustainable and profitable business venture. Thank you.